Hi, my name is Elisha Lewis, and tonight I'll be presenting Sexually Violent Predators, otherwise known as SVP. So, what exactly is a sexually violent predator? Sexually violent predators are individuals who have been convicted of a specific sexually violent offense against one or more victims and is deemed to have a mental disorder that makes them a danger to the health and safety of others, and that it is likely that he or she will engage in sexually violent criminal behavior. So for the DSM, sexually violent predators are not a specific diagnosis, yet they are generally classified as a paraphilic disorder, which leads to criminal behavior in a sexual manner. Uh, Sometimes. So voyeuristic disorders, exhibitionistic disorder, frauderistic disorder, sexual sadism disorder, pedophilic disorder, sexual masochism disorder, fetishistic disorder, and transvestic disorders are all disorders of a paraphilic type that can lead to sexually violent predatory behavior. So the DSM-5 criteria, diagnostic criteria is atypical sexual interest. They experience recurrent, intense sexual arousal from a focus that is atypical in nature. Duration is patterns that have occurred for at least 6 months, and the distress or harm experiences personal distress or impairment in social, occupational, or other important areas of function due to their sexual interest. Have acted on these urges with a non-consenting person. So for California state laws, SVP laws implemented in 1996 were the Welfare and Institutions Code of 6600. Commitment process, individuals are screened by mental health professionals to assess whether they meet SVP criteria. Civil commitments are determined to be SVP. The individuals may be committed to a state hospital for treatment. Annual reviews of petitions. Each year, there's an annual mental condition review, and the patient can petition for conditional release or unconditional release. Conditional releases are strictly supervised and monitoring during transition before a full release can be obtained, and then notification requirements are required by to be notified law enforcement and victims before the release occurs. So the effectiveness of SVP laws as of 2020, here are some of the statistics that come from the California state website. California has the most inpatient SVPs of any of the 21 states with SVP laws. Nearly 1,000 SVPs represent 15% of the national total. California had 534 fully committed SVP patients, and California had 429 SVP detainees. 202 detainees have been released, and 265 fully committed SVPs have been released. The yearly cost for one SVP is $205,000, and the yearly cost for evaluation services is $18 million. So my thoughts on the effectiveness of California SVP laws. I think it's um, significant of to note that California has the largest concentration of SVPs among the states that have similar SVP laws. And I think the effectiveness of those programs suggests that while California is larger than most states, we still have a significant amount of work to do to strengthen the laws and reduce the population of sexually violent predators in the state. I also think that it is imperative that we find alternative ways to help individuals that are suffering from these disorders in order to alleviate some of the strain on the correctional system as well. I think it is important that as a society, we look for ways to return individuals to the communities in which they live and are a part of, while also balancing public safety and security and making sure that others are not violated while we balance those two competing priorities. So I think the effectiveness overall could use some work, specifically in regards to how do you reduce the strain on incarcerated individuals while also balancing the public safety aspects of sexually violent predators in communities that they have once been a part of, and returning those individuals back to those communities. And here are my resources that I consulted for the presentation. Thank you.